And welcome back to The Factor Uncensored. Communication skills are important, especially when it comes to talking with your doctor. Dr. Danish Ali with Archpoint Pain Institute joins us now to talk about why it's so important for you and your doctors to be on the same page. Dr. Ali, I thought this was a very important conversation to have because many people have a misunderstanding when they visit their doctor's office, and many of them walk away sometimes upset, sometimes offended, feeling like the doctor is not spending enough time with them, respecting them, giving them the information they need. So as a doctor who sees patients all the time, what would be your advice when someone comes to see you as a physician? What should they have prepared, and what should they be ready to talk about?
Yeah. So Isaiah, as a patient myself, I can totally understand some of their concerns as well. I'll tell you that with changes in the healthcare system, it's been so difficult for physicians to practice the way that they've been able to practice in the past. And what I mean by that is now there's so many middlemen, I would say. There's so many loops that people have to go through, physicians and doctors' offices have to go through to, number one, get the patient in the clinic, whether it be insurance authorizations, or if they have like an HMO plan that requires a referral from their primary care doctors, that can be another hindering factor. And then once they're actually here, there's just so much paperwork that's involved. I'll tell you, I do so many prior authorizations for medications, which basically the insurance says, hey, doctor, you prescribed this medication, but we want you to actually prescribe this medication instead, even though they have no records of this patient's history. They don't know what it is. It's just a cheaper alternative for these insurances. And now they are, denying the medication that we had initially requested. So
and
now
the patient will think it's you.
Right, exactly. The patient keeps calling our office and they're frustrated because now, we have more paperwork to fill out, number one. But number two, we have to get that back to them. Then they have 24 to 48 hours to review that. And then they'll get back with us and or the patient. So that causes a delay in all of this stuff. And then now, some of these medications aren't available in pharmacies. So then we go through that whole loophole, and then you've got another obstruction in the way to get that medication where it may not be available. Then the patient calls back the doctor's office. So there's so much back and forth that's happening that the team or the patients may not see that we're working with all these patients. And so my point or my recommendation to folks is just to be patient themselves as well and realize that not everything may be the fault of the doctor's office or their lack of maybe picking up the phone. There may be other things that are going on in the background that are hindering their ability to get the medication, the treatment, those sorts of things.
Now, when they walk into your office, what would be helpful to you if a patient walks in and they're visiting you for the first time? What would you like to see from them when they walk in, or putting your portal before they arrive?
That's correct. Now with technology, Isaiah, folks are able to go online and fill out a lot of the paperwork that they can do beforehand, before visiting the doctor's office. There are HIPAA compliant methods of submitting medical records as well as imaging results. And so if somebody's coming to me with back pain or pain down their leg, it's very helpful if they've had an MRI or an X-ray for them to send that beforehand so we can view that, we can have that uploaded, so that way the patient's not waiting to get those results uploaded, for the team to view those results, and for the physician to interpret those results. So those are all things that they can do before. Obviously, bring your medical records. We don't need, per se, most of the time, 20 years of your records. The last couple of years, just kind of showing a general history of what has happened, if you have that. The best thing you can do is synopsize it. I call a Cliff Notes version of it. If you can give the physician a Cliff Note, or maybe even a timeline of, hey, within the last 6 months or a year, this has been what's been happening, and this is a timeline of it, that helps a lot as well. things we can do in preparation of seeing the team and the physician, and they can obtain these results and these things beforehand. And a lot of times the physicians do like to look at it before the patient is seen, so they kind of have an idea already of what's in store for them.
Stay with us. We will continue this conversation on The Factor after the break. Back to The Factor Uncensored. We continue the conversation with Dr. Danish Ali with Archpoint Pain Institute on the importance of having all your things together for your doctor's appointment. When you have a chance to talk to the doctor, many people want to talk their asses off, Dr. Ali, but you guys have limited time. So you want a quick conversation or overview of how they feel, what they're dealing with, because you can't spend all day with one patient, right?
That's right, Isaiah. I cannot agree with you more. Be concise. Give the story about what specifically you need addressed. If you have a notepad or something you can write your questions down on, that way you're concise and you can ask those questions and get the answers you need. Because a lot of times, as you said, yes, the time is of essence. And a lot of times, you know, the history 20 years ago is not as relevant to what's on hand. So keep it concise, give a timeline, ask your questions as well, have it written down. And I think that way the process can go by a lot more smoother.
Excellent. And once again, let's go over it. Have your information, if you can, put it into the portal before you arrive there with a little bit of your medical history, not 20 years. And when you're in front of the doctor, make that conversation short.
That's exactly right, Isaiah. And have a lot of patience with the doctor's office and the whole team. They're working hard to take care of whatever needs you are inquiring about and need help with. And so they're working hard on the back end as well.
All right, Dr. Danish Ali, Archpoint Pain Institute. Always good to see you, sir.